6 minutes, please.
Well, thank you very much, Chair, and thank you, Mr. McGregor, for being here, and Ms. MacDonald. Obviously, we've heard from expert witnesses on this, and it certainly is. We've identified, I think, some knowledge gaps as well. One of the things that we asked many witnesses was to present a little bit to the committee with respect to symptoms that individuals may suffer with, whether they, regardless of the type of injury that they received, and it seemed difficult to present that. One of the things that, of course, we heard from witnesses was specifically related to children who have had head injuries, whether it doesn't matter what the cause, whether they be birth-related or related to injuries, sadly sometimes related to things like shaken baby syndrome and moving on through the years to sporting injuries. Is that part of the hope that we'll be able to unpackage some of those symptoms for parents and or caregivers to enable them to better identify when children may have had a head injury, for instance, or simply but not so simply be also suffering from a mental health issue, because sometimes there's significant overlap. So I wonder if both of you might comment on that. You can decide between yourselves who's going to go first. How's that?
Very much. So children do experience brain injury, and for the very young, it's hard to vocalize their symptoms, and it's often subjective that you look at the symptoms to diagnose. But those with more severe injuries are going to, as I mentioned, it's a chronic condition. This injury is happening to a developing brain, and that will impact their long-term trajectory. And so we need long-term care for them, not just until they're 18 and they come out of the pediatric system. We need to support them over the long term, and that support needs to be individualized, not a one-size-fits-all. It needs to be customized to that individual, as well as their family. Their family needs customized supports as well to help these children through these conditions over their lifespan.
And I think, what I'd add to that is, there's a lot of expertise out there in the field, Dr. Ellis, and I think, we've heard it earlier at this committee. I think my job with this bill was really to try and create that legislative space that helps them do their job in a coordinated fashion. And, we're a big country, we're very regional, and some provinces may have more resources than others, but they're all feeling the effects. And I think with children, because they have a developing brain, the long-term consequences can be quite profound. And I think in addition to what you just heard from Ms. MacDonald, I think Mr. Fleiser from last week was also talking about the work that his organization has been doing, especially with respect to kids in sports. So, yeah, I think that's where I can leave it. Thank you.
Well, thanks very much for that. One of the other things I had the opportunity to speak to Mr. Adrian Dix, who's the Provincial Minister of Health in British Columbia, and certainly, as we know, it's the epicenter for the safe supply drug experiment, which, of course, we're talking about in this committee as well. That being said, one of the concerns that he raised was related to hypoxic brain injury for individuals who suffer from substance use disorder, who've perhaps been very sadly revived many times. Do you think, I know that both of you spoke about that particular type of injury, which sadly, as I said, is becoming more and more prevalent. Is that something that you'll be very directive with this framework in terms of asking people to look at this burgeoning new type of brain injury? And the other difficulty, of course, is housing those individuals. Not appropriate to house those individuals with perhaps senior or geriatric patients suffering with things like dementia. So do you have any hopes in the framework that that'll be specifically a part of it? Maybe we'll go in the reverse order. Mr. McGregor, maybe you could start.
Yeah, thank you for the great question, Dr. Ellis. This is truly an issue that is gripping so many communities right across Canada, and I know we have had some very passionate debates in the House of Commons and at various committees on this subject. But, as I said in my opening remarks, it can be like a vicious cycle. You can look at the symptoms that many people with brain injury exhibit, and they can have poor judgment, impulse control, and other things that may lead them on a path towards drug use as a way of managing what's going on inside their own bodies. But of course, if they get a hypoxic brain injury, then we've got this vicious cycle starting. I think what I wanted to do with Bill C-277 was provide a positive legislative measure that so far we can all get behind as something that is going to tackle some of the spin-off effects from this. And I think from what I've heard from around this table and in the House of Commons, we seem to have a lot of people in agreement that this could be helping that very serious problem in so many of our communities.
And I mean, brain injury causes can cause, opioids can cause brain injury, and brain injury can lead to opioid overdose. So we need integrated care models that address both the substance use and the brain injury. We can't treat one without the other. We also, these people fall in a gray area. They'll be treated for their overdose, but they are not always treated for their brain injury over the long term, and they don't know where they're going for support. And so we need to treat this over the long term.
Thank you.
Thank you.